So guys, welcome. I'm here with two of our students who've managed to get all the way through placement nearly. I'll let them introduce themselves to you.
Hi there, my name's Lyle Brennan.
Hi, my name's Soraya.
And do you want to tell a little bit about your backgrounds, what your placement experience was before this, what year you in, and what you found interesting before coming on placement?
Yeah, certainly. So I'm a year 2 physio student. This is my third placement. My first placement was in a outpatients MSK clinic, and my second placement was a sort of community, primarily MSK / falls team side of things, really.
So I'm also a second year physiotherapy student, and this is my second placement. My first one was elective orthopedics, and I couldn't join my first actual one because I was off sick, but that was MSK, but this is my second placement.
Excellent. So you might have seen online, or if not, if we haven't posted them up yet, I'm not sure what order we're going to do this in. These guys have done some video reflections, focusing on what they've learned and how it's been for them as an experience on placement under no duress at all. Don't smile. If that's not out, then that will go out, then you'll see that as well. But one thing we did talk about was we're going to do an interview with the physio students. So we asked you guys on the internet to give us some questions to put to these guys. So you responded really, really well. And I'm just going to go off the list in the order which people replied, I think. So first off, Reese Perrott says, what do they think about the standard of the course, and if they think it sets them up for a successful transition into working as a physio?
So as we mentioned, we're from University in Nottingham. I think the standard of the course is very good. There's lots of different things, obviously, that compile together to make physio, and I think it's going to be difficult to cover all of that to a degree where, you know, when you're qualified, you're going to be able to do every single thing perfectly. I think what we cover really well is the MSK, the respiratory, the neuro side of things. But I think there is certain things where we could do with a little bit more, such as the mental health side of things and the learning disability side of things.
So I think the standard of the course is really good, but I just think overall, I'm pretty sure a lot of students would agree as well that placement's the time where you'd learn the most. For example, for me, I'm more of a visual learner. So if I see something happening right in front of me, rather than on a Teams meeting, it goes into my head a lot quicker. So it's much easier to understand. So I think placement's a time where I learn a lot more. So I think the standard of the course is really good, but it's just maybe more practice experience would be nice.
I think it's worth bearing in mind in this question that you guys are in your second year of practice. So, you've just past the halfway point in your time at university, still half a degree left to go. For you, this is only a second clinical placement, and so those things I think will come in time. I think for if I'm just going to chime in with my 2 pence, that it's tricky, and I say I want to use the classic phrase of it depends. I think it depends on what area you're going to work into. I think the bulk of physiotherapy practice is in MSK, neuro-respiratory. Or probably maybe not even in that order, and there are a ton of specialities underneath that include amputees, working with the elderly, pediatrics, learning disability, mental health, burns and plastics. I could go on forever, and so it's challenging to set people up with all of those. One of my big beefs, and one of the reasons that I push over here for learning disabilities, is that there are core skills that you can gain from working on here, focus on communication and relationship building, that are transitional, and they can be taken and used in any area of practice. And I think if universities and places of education perhaps understood about how we could interweave skills and fundamentals of communication, and learn from such as people who work with learning disabilities, then you will set your students up to be better communicators with your mainstream patients. Okay, so next question from Ollie Colburn. Ollie Coburn. I'll edit that bit out. If I haven't, Ollie, then sorry. So from Ollie Coburn is, how many of them want to work in non-MSK settings? Soraya?
I think I do want to work in a non-MSK setting.
Yeah.
I did go for a few days in my first place and I really didn't like it. Like, that's the honest truth. I didn't like it at all. I felt like it was like very rushed. There wasn't enough time to like keep notes, and it was like 15 minutes with the patient. Like that would be like what we've done in the introduction stage at this placement. So that's like says a lot about how much time we get with each patient. So I just say I wouldn't really enjoy it because I like building rapport with patients and building relationships with patients. And I think this placement showed me that that is possible and not really like possible in an MSK setting because it's so fast paced.
I think we're both a bit contrasted to the majority of physio students, I guess, because I as well, it's not that I dislike MSK, but there's other areas that I prefer. So if I had a choice, I wouldn't preferably go into MSK. I would prefer neuro and respiratory. It's sort of 50-50 between them, really. So at the minute, I'm not really sure which one I prefer more, but definitely them two over MSK for me at the moment, I think.
I think, you know, it's an interesting question to look at a non-MSK setting. I work in what is traditionally classed as a non-MSK setting. However, I use MSK skills almost every single day. So I think the fundamentals of what makes MSK practice, you know, am I seeing somebody because they've got back pain? Occasionally, yes, but not every day. Am I seeing people because they've hurt their knee? Again, not every day, but sometimes. You know, people with learning disabilities have the same musculoskeletal issues as the general population, in some areas more than other people. So I'd say, you know, it's okay to be able to say I don't want to work in a traditional MSK service, but physiotherapy is so diverse these days that, you know, we can't say that we don't want to. What I'm saying is those MSK skills will still be of value in any setting that you go into, whether that's cardiorespiratory or whatever.
Most definitely.
Do you realise that physio is 80% admin in the NHS? In the NHS, asked John Owens. Lyle, you've probably got a bit of experience about that.
Yeah, sadly so. What? No, so I'm a mature student. I'm 28. I've worked as a physio assistant for about 7 years. So I'm quite familiar with the NHS admin side of things, which is quite numerous, I guess, isn't it? It's a very different in private placement, I think. We still obviously have all your standard of clinical notes and everything, but there's, I think one of the main differences is your competencies side of things. So obviously within the NHS.
What are you saying? Hang on a minute.
Obviously within the NHS, there is, you know, we go on, you know, days training multiple times, lots of things like that. Whereas here, I think it's going to be easier to manage in private practice, I think is a safe way of saying it.
I love how you sort of backhandedly saying that Alistair's incompetent and doesn't do any CPD. Just for reference, I spent a day last week doing my annual CPD. I just do it in a different way. So I did an online course. But yeah, I think, sorry, Soraya, your take on that. Do you realise if physio is NHS as admin?
I have realised that now because I came straight from sixth form, so I don't really know much about the career itself. I knew I wanted to do it, but I just didn't know much about it. But yeah, like now I realise that there's a lot of note keeping and a lot of writing to do.
Yeah, certainly. I think it is different, and I think the NHS is such a large organisation, and it provides structure and support with things such as a knowledge and skill framework. Obviously, you've got your baseline competencies to keep up, which we have to keep up in private practice as well. It may just be that I think with larger organisations, more people brings more complexity.
It's harder to manage, isn't it? It's definitely harder to manage.
Next question from this guy who's not very well known, to be honest, for being on the internet. Martin Christensen. It says, if they like me more than you.
Yes.
Well, you don't even know who he is. What? There's a great example there. A great example that they've not been primed. Anyway, shape or form. Oh, I'm gutted. All right then. The next question, which you may have already sort of alluded to a little bit in terms of your answer, what do you know about the role of the therapy support worker from Chris Richards?
For me, yeah, as I mentioned, I was a therapy support worker for quite a while. So I know, I guess, a fair bit about the role, hopefully. For me, what the role of a therapy support worker is, it's very paramount to patient care. as a physio, you're going to be assessing your patient, doing initial treatments, but you might be seeing, let's say, an inpatient neuro unit. Ideally, you want your patient seeing 5-6 times a week. Let's say as a physio, you're going to have umpteen other patients to assess. You're not going to be able to make them contacts. The role of your PTA is to effectively fill in them gaps in time. So they help tide patients over and carry out treatment plans for you, basically, is sort of my understanding of it.
Before university, I didn't really know much like about them, but I've only shadowed physiotherapists. So I've not got a chance to like be around PTAs or know exactly what they do.
At Portland, actually, the vast majority of the people that you met there there's a larger PTA bias in terms of how they structure the clinic. So I think, you know, one of the things we're looking at is placements and how we integrate together. Obviously, this placement offers limited opportunities for integration because, you know, we're here in a clinic going to people's houses. But I think, you know, the role of the therapy support worker, I think, is paramount, and there's a big push at the moment from the CSP to try and upskill and try and utilize support workers at a time when, rightly or wrongly, services are being strapped for cash, and, you know, people are trying to ask people to do more for not necessarily less, but, you know, they're trying to look at diversifying skill sets and upskilling people where possible. So I personally believe I worked with a team with three qualifiers before this, with 7 support workers, and they ran the place. To be honest, they ran it. You know, day-to-day sort of stuff. I could have, you know, been zapped up to space, and they might argue that some days it felt like I was, and they ran it. So yeah, fabulous. Couldn't do my job without them, and would like to get to a point where I'm able to employ some in this setting, but we'll get there. Okay, next question coming in from Luke Todd, saying, what is it really like working with the LD physio? This is a safe space. Now, I've caveated this by saying this answer may depend on whether or not I've given them final mark, but clearly, as you just stomped all over me earlier on, you don't seem to care because you've not had a final mark yet. So yeah, what's it really like? Soraya, I'm gonna let you jump down the lion's gullet there.
To be honest, it's really fun. Like, I didn't expect to have this much fun on placement. I thought, like, compared to my last placement, like a normal 9 to 5, you go there, you don't really speak to anyone, and you just do your job. But it was really fun here. Like, we had a lot of jokes, a lot of sarcasm, and just driving like everywhere, and it was just really fun. Like, we'd just be talking the whole time. Like, it was never uncomfortable. Like, I felt comfortable during the whole placement. If I was like unsure about anything, like, it is my second placement, I could ask Alistair, and he would try and help me in a way where I would learn, and he wouldn't like make sure that I just not do anything, but try and push me to a point where I was confident enough to trust my skills. I think that's something that like I can push forward into my other placements as well, and obviously into my future practice as well. Like, this placement by far has like been the best one. Obviously, I've only had 2.
Shut up.
But in the way of like building my confidence, I think this placement is like sort of that one to push me forward into my next placements. And it's like, because it's such an at ease environment, we're having so much fun, it doesn't feel like I'm being assessed at all. So that makes me want to do better, and it makes me like not feel under pressure at all.
Oh, thank you. It's nice to hear that.
I'm not just saying this just because Alistair's sitting right there and paying at what?
Thanks, thanks, Toddy. Appreciate this question.
But I only honestly echo the same. So sort of like from day one, I don't think I've ever felt as sort of comfy and at ease, and, you know, the normal sort of placement nerves that you get just sort of not really there, to be honest with you. Alistair's just been absolutely fantastic with us both, even through things, just as simple things like, you know, communication and getting us to, again, just feel at ease with patients. As Soraya mentioned, it's sort of like you're not really being assessed, you know. We know we are, but because it's just been such a nice, relaxing environment, it's just been so easy to sort of just get along and do what we're here to do, really, is like a better way to put it.
Extra 5% on both the marks there. Well done. Okay, so the people of Instagram have been in touch, and we have responses, everything from don't be too hard to full out interview questions. So people thinking that I'm going to be the one setting the questions. The reason I asked you lot is because I can't be creative in my thinking, so you do my job for me. So yeah, Abby, it's not my choice whether or not to be hard on these questions. Although if you're Claire McGregor, you clearly want to give them a full interview. So we're going to go with some of these. Tell us about a time you've had to make reasonable adjustments for a client. What was the outcome?
I think for one of the patients, like at times, like I would forget the baseline. Like I'd straight go to progression and not knowing like what I'm sort of doing in a certain way. And this is like towards the start of placement, because I haven't come across like having to like help patients with learning disabilities. So neither did I see them before. So I didn't really know their baseline. So I think having to like observe like what the patient's baseline is and sort of adjust the treatment plan according to them.
Yeah.
Not something I want to put on them, but sort of shared decision making, sort of like patient-centered care, see where the patients are, see what they're comfortable with, and adjust my treatment plan according to them.
And how what things did you do in your treatment plan to adjust?
Like sort of make exercises easier if the patient found it too difficult, or opposite, if the patient found it too easy, how to make it more difficult. And at times I needed a bit of prompting with that because I didn't get it straight away. But I think now it's kind of like instilled into my head, like how can I make it easy and how can I make it harder for the patient?
Yeah. And I think with that, just one of the things that comes around that is adjusting our language a lot as well. I think in terms of reasonable adjustments, that's what anything is reasonable, and obviously adapting our language are probably the first thing that we do. That we probably do that without thinking, but you'd be surprised the amount of places that you go to work where people think they shouldn't have to change how they speak to get people to engage. That's their problem, and it's all too common.
And also, like, sorry, I just wanted to add, like, one thing I learned on this placement as well is that it's not what I say to the patient, it's how they understand what I'm saying. So normally, obviously in elective orthopedics, I just read what I needed to read or say what I needed to say and assume my patients understood and just kind of walk away from the situation because I didn't have a lot of time with them. But now I've kind of understood that I need to adapt my communication styles to make sure that the patient like understands and know what they're like, know how sort of they like to understand things and sort of adapt it to that. So I need to adapt my way, not and vice versa. The patient needs to adapt the way they need to understand.
I think mine's really sort of in line with that last point you mentioned there around that communication side of things. So obviously when you're working with brain injuries, learning disabilities, and even maybe some people without, for us, when we explain exercises, it might be sounding very simple to us, but there's been a few times throughout this placement where I've wanted a patient, say with a brain injury, to understand what I'm saying in regards to me trying to get him to follow an exercise through, even something as simple as a squat, and me trying to explain that. Something that I found really helpful is just really making things bare bones and simple. So for instance, if you are trying to explain a squat, if they're not understanding it, just say sit down and stand up, and then sort of adapt it from that point on. I think throughout this placement, we've needed to sort of adapt our communication with getting patients to understand almost every single exercise we've run through with, and for me, I think that's been one of the main sort of adaptations that we've had to do.
I think one thing that's worth mentioning is obviously these guys are coming to this placement where I've got an active caseload that I've been picking up for a couple of months prior to. And so a lot of the reasonable adjustments that we would traditionally be looking at with a question such as this, these guys may not have faced that in terms of a challenge. So reasonable adjustments that I've made in the past have been, I saw a person in the car park because they didn't want to come into clinic. I've worked with people sitting on the floor. We've done telephone calls. We've done prior information to people coming into clinic. We've done orientation visits. I think because we're seeing people first and foremost in their homes or schools or whatever, we haven't necessarily had to face the sort of traditional first contact assessment challenges in terms of reasonable adjustments that we might expect, for example, in a community NHS setting.
Well, it was only last week, wasn't it? We had you on the floor pretending to be asleep for a patient to encourage him to roll across.
Yeah.
To you.
Oh, I wasn't pretending. I wasn't pretending. I was genuinely having 40 winks. Genuinely. Okay. what do you think person-centered thinking is, and how does it apply to physio practice? I'll come to you first this time, Lyle.
To me, it's, again, as cliche as it sounds, it's about understanding what we as therapists want to gain out of a treatment session. And then how can we sort of marry that up with what are our patients' goals? What can we then do for what we want to do? How can we adapt that to achieve what they want? I think it's about, instead of just thinking, okay, this person's got XYZ injury, research says do this. I think what's important is to think, okay, what does our patient want? How can we adapt what we do here to implement that to their care, so that then we're sort of giving them the best care specifically for them. So I think for me, it's about that adaptability of approach, and not just being sort of steel and lead in, this is what I'm going to do. Even if it doesn't work with this patient, this is still what I'm going to do. So it's about that adaptability to ensuring that when we're performing practice, it's beneficial to our patient.
I think for me, it's like the same, like just more about like shared decision making, knowing what the patient wants from their treatment and how we can like achieve that for them. And it's more of like putting the patient first, so like meeting the needs of the patient. Like on this placement, I also learned like we need to make sure, like for example, one of the patient's wheelchair wasn't adjusting to them properly. Like we'd make sure at the start of like our session, we'd adjust that for them first. So it's like not just helping with what we want to do, but it's also seeing what the patient needs as well, and how we can meet their needs at the same time.
I think you guys have probably missed, there's probably some stuff that you've sort of glossed over psychologically there. There's a great examples, I think, but there's a great example about person-centered thinking. There's been some times in this placement where we've come across that gentleman who needed his chair adjusting and putting that person at the center of everything. So we were just talking about the fact that actually from a physio point of view, it's fairly simple with what we want to do with this person. But actually there are a whole other raft of things which influence how that person presents in front of you. And without trying to address those within the best capabilities of our professional framework, we can't, we can't progress with what we're doing. This person's chair was the keystone. Obviously that brought up a lot of other issues about that person's ability to work, about that person's meaningfulness and feeling valued as an individual, because they couldn't work as often, they couldn't go out as much, they needed to make changes to their vehicles, and they got a new chair. There were some challenges around the sort of the household dynamics around how that person and their partner were sort of working together. All these things need to be brought to bear when we're working with people, and if they're not, then we're missing a large chunk of what makes people people. And person-centered thinking will be putting the person at the center and saying, look, what is it you want from this, which you guys sort of alluded to. Okay. Oh, and I like this one, and I'm going to try and keep quiet at the end of this one because I've got a real bee in my bonnet about it. What do you think professionalism is, and how do you demonstrate it? Feel free to go, whichever one of you wants that one.
For me, it's quite a difficult one, because there's obviously that view that people have of professionalism of, shirt and tie, leaden face, you're there to treat the patient, and you sort of sometimes can leave a bit of yourself at home, I think, when you're working in healthcare, because I think it's enthralled a little bit in people. But for me, professionalism is more about finding a way to treat your patient which benefits them the best. If I can treat a patient and they respond better to me being I don't really know the correct term for it, but completely official with everything I say, that's fine. That's something that I can do. But also, if I'm treating a patient who also just wants to be talked to as if I'm just a normal standard person, I think being able to adapt to that is more important than just sticking in this one framework of your mind of, this is how I have to act with everybody. So professionalism to me isn't necessarily about just acting that same way throughout, following not exactly the guidelines, because it's
less formal, isn't it?
Yeah, it's a tricky one to say, but yeah, that's the word I'm looking for. Just less formal if it needs to be, sort of thing.
I agree with Lyle. I think it's just adapting your communication and like the way you present yourself according to the patient you're presented with. And I just think like if I agree, like if a person like likes communicating in an like official way, more like physio terms or something like that, then you'd communicate in that way. But if you're coming across a patient who's like stroking around or likes having fun, you can make physio more interactive and enjoyable. So it just really depends on the patient.
Yeah, completely. And it's not, you know, from my point of view, and you know, others may disagree, and some people do disagree with how I go about my clinical practice and social media antics, but professionalism is whatever the person needs it to be. I think professionalism has been a bit of a tool to wield, or a bit of a baton to wield over physiotherapists and healthcare professionals' heads for far too long. And I think actually what we're seeing now is that the erosion of that, hopefully, and that ability to be more personalized in our approach, whether that is adapting your communication style, whether that is about showing and being human and using that to build relationships and therapeutic rapport. I think those are almost more important skills than worrying about, you know, whether you used an overly, whether you call somebody duck. But again, in certain contexts, you know, being overly familiar with people is important. If that's what that person wants or needs, it's important that we get that right for that person. But professionalism for me is whatever the person needs it to be. Guys, thank you so much for your time in this interview. I know that you've been both a bit terrified about doing this, and particularly as you're both not necessarily, you know, on social media a huge amount. You know, I sort of thought getting some students was like great. You know, they'll be able to sort my social media accounts out for me, and you two are like, no. So I really appreciate you sort of putting yourselves out there and pushing yourselves out your comfort zone. You know, this whole thing has been about you guys, your learning, but also trying to show that learning disabilities is, you know, as a recognizable area of practice within physiotherapy, and that there are skills that you can learn and take onto other placements. So my final question to you two is, I'll start with you, Soraya. What is the one thing that will stick with you that you'll take into other placements? What's the one thing that you've learned that you will take into other placements that will benefit you the most?
Adapting my communication. So like not practicing what I'm going to say in my head, but when a patient's in front of me, sort of going back and forth with questions, and just like making sure that the patient, like I say stuff in a way which the patient will understand, and not exactly what I want to push onto them, and sort of like building rapport with the patient, like not talking to them in a way where they just think she's going to say some words at me and she's going to leave. So like making sure if I ask them if they understand, making sure they can ask me questions, and just building a relationship with them.
With the risk of being repetitive, quite honestly, the exact same. It's about that adaptability side of things and that communication side of things. I think you mentioned a really good point there about, as obvious as it sounds, just making sure what you're saying is understood. Because I think it's going to be all too easy sometimes for patients to be a little bit rabbit in headlights, especially say if you're in a busy MSK clinic and you're talking physio terms and they're just sort of, yeah, nodding along. And I think what's important is for us to make sure that the patient knows what we're talking about. So for me, it's that adaptability around ensuring how you approach that, really. I think it's one of the main things for me.
Guys, thank you so much for your time. Hopefully it's been useful for you guys. Please, you know, chuck your comments below. We can pass it on to these guys even after placement is finished. We've still got contact information. Thank you very much for engaging, and we'll see you all again.
Thank you.
Thank you.
Bye.